folks. Welcome to the program. This, of course, is Stinchfield, the podcast. So President Trump signs what could be a generational executive order to literally change the way we pay for prescription drugs in this nation. He calls it preferred nation status, favored nation status, meaning that we're going to pay America the lowest price for prescription drugs. This is a great move. Sadly, less than 24 hours after this executive order is signed, quietly, Big Pharma is going through it with a fine-tooth comb, and it's not long, finding all kinds of loopholes. One, to delay the institution of this favored nation pricing, and two, ultimately delay it so they can fight it in court. Now, I think there's some ambiguity in this executive order to allow President Trump's team to put up a better case in a radical judge's court, a radical judge's court that was most likely judge shopped by those on the left who want to derail President Trump. But let's face it, this executive order could have come straight off of Bernie Sanders' desk. This is exactly what Elizabeth Warren and Nancy Pelosi wanted. This isn't some great piece of conservative think tank executive order. This amounts to exactly what the Democrats wanted. And in many respects, you could argue that's why it's so brilliant. How are they going to argue it? Amazingly enough, they do. So we'll talk about all this and what Big Pharma is going to do to hit back at President Trump's attempt to rein in drug pricing, 30 to 80%, as Stinchfield gets started. Of course, the show is brought to you by the Wellness Company, twc.health/grant. These are the prescription drug medication kits. Every family should have one in their home. There's prescription medications in here, including amoxicillin, azithromycin. You've got ivermectin in this kit, all kinds of things you need. And there's a number of different kits you should consider as you make sure you keep your family safe. And then, of course, there's the parasite cleanse. I'll tell you about that. And all kinds of products are going to keep you healthy on the Wellness Company website, twc.health/grant. Use the promo code GRANT. I urge you to do it today. Let's get the show started.
Uncensored and unapologetic. This is Stinchfield. Here's your host, Grant Stinchfield.
All right, folks. Well, with me today is our good friend, Dr. Kelly Victory. She is with the Wellness Company. Dr. Victory, you spent so much time in emergency medicine, so much time as a doctor prescribing medications. Let me ask you first off, what do you make of this new executive order from President Trump? And of course, welcome to the program.
Thanks, as always, for having me, Grant. I think that the executive order is a bold move on the part of the president, and one that you would expect, as you said rightly in your open, would garner tremendous bipartisan support. The Democrats have been very, very focused on driving down prescription drug prices for decades. And so this would fall clearly, you would believe, on the favorable side to them. I think you do point out that there are going to be some concerns about how to operationalize it, and we can get into the weeds on that. But the reality is this. For decades, Americans have been raped over the price of prescription medications. We spend far more than other countries do for the exact same product. The government did a study back in 2021 comparing Canada, France, Australia, and the US, and found that on average, Americans pay 2 to 4 times more for the exact same medication. So what fundamentally this executive order aimed to do was to say to the pharmaceutical companies, we are going to look at all of the countries that have favored nation status, and that is not all countries of the world. It's largely industrialized countries and those that, by definition, I think, where the GDP is 60% or greater on average of what we have here in America, and to compare what the drug companies sell a particular product to all of those countries. And then say, well, whoever you sell it to the cheapest, that's the price that we want in America as well. Now, this would largely, it seems to me, be applicable to Medicare because that is a federally run program. I'm not sure how the intricacies would work with regard to the executive order or the president being able to control or demand particular pricing from a drug company when it comes to private insurance. But overall, he is exposing something that Americans, I think, have not understood, which is that we in America are paying the yeoman's portion of the what it costs for research and design and marketing and everything else. The drug companies are not spreading those costs out equivalently or equally to other countries. We just take it on the chin every time.
It amazes me that America is supposed to bear the burden of this research and development. That's what we hear over and over again. Oh, well, the price is so expensive because of research and development, and not every drug hits. And when you get a hit, well, then that's great. But it takes all these other drugs to fail, and the money that goes into it's so expensive. I just don't think it's fair. Now, there has been some celebration over this. I'm going to go through some of the loopholes that Big Pharma appears to be finding, but first, I do want to give the president his due and celebrate this a little bit. I saw this video by the White House. Check this out.
Starting today, the United States will no longer subsidize the health care of foreign countries and will no longer tolerate profiteering and price gouging. For the first time in many years, we'll slash the cost of prescription drugs, and we will bring fairness to America. Drug prices will come down. We're going to cut out the middlemen and facilitate the direct sale of drugs at the most favored nation price directly to the American citizen.
I'm just so grateful to be here today. I never thought that this would happen in my lifetime.
This is the most powerful executive order on pharmacy pricing and healthcare ever in the history of our nation. By getting our allies to pay a bit more, we'll course correct a problem that's gotten out of hand.
We're standing up for the American consumer who's been paying far too high prices for far too long.
We didn't take an oath to heal patients and then watch their life get ruined financially. We're going to do everything we can at the FDA to support this executive order. It's transformative. Thank you, Mr. President.
All right, so the White House puts that out. You heard a couple things there. One, other nations may have to pay a little bit more. President Trump called it a redistribution of wealth. I cringed when I heard him say this, but I mean, he's talking the Democrats' language here. They're going to try to argue with this. I was going through the executive order, and then I looked at some other assessments of this. Big Pharma is going to see that in the beginning, there's some voluntary compliance on this and delayed enforcement. That delayed enforcement, I think, is going to give Big Pharma the chance to go try to really fight this in the courts. We already lost one battle on a similar executive order during the first administration on this. How do you think this will stand up in the courts?
Well, tragically, Big Pharma is the strongest lobbying force in Washington. They have tremendous resources. And I agree with you, if they are given any opening to fight it in the courts and to delay, they will. And given what we are seeing from the judicial side recently, I don't have any great hopes that there will be fairness and balance here. The idea of actually spreading the costs out equivalently across favored nations, I think, makes sense. And Americans should not be bearing the burden of this. All that said, Big Pharma will push back. They will rally their forces and bring to the extent they can, delay as much as possible until they can find a loophole to overturn this. Now, interestingly, the president included in that clip there a totally different piece, which is the concept of middlemen. And we should talk a little bit about that, because that's something that I've been pushing for to address the issue of middlemen separate from all of this.
These are the pharmacy benefit managers. So I'm gonna make a note so we come back to this. But I want to clean up this before we get to pharmacy benefit managers, who really drive the price of prescription drugs sky high, in my opinion. So we'll talk about that in a second. This is your friend, Robert F. Kennedy Jr. on Fox News talking about this executive order.
Mr. Secretary, Trump says some prices will come down almost immediately. What is the timetable for these price cuts?
Well, there's a series of escalating steps, but you know what? That will bring them down to European levels. Right now, America provides 75% of the pharmaceutical revenues in the world. And we only have 4.2% of the world's population.
Sure.
We're paying in our country, the list price for Ozempic is $1,300 per dose. In London, it's $88. And Democratic and Republican politicians have been talking about for years, we got to end these discrepancies. Nobody has had the courage to do it because of the power of the pharmaceutical lobby on Capitol Hill.
Okay.
In answer to your question, how soon will this happen? It depends on how enthusiastically the drug companies cooperate. There are a series of escalating steps that we will take if they don't cooperate. But we've been meeting with the pharmaceutical companies. They admit that this is something that should have ended a long time ago. And I think they're ready to figure out a way to get there. And they have advantages in this executive order, Stuart.
Okay.
Because we got rid of the PBMs. We got rid of the middlemen. And that's something that they've wanted themselves.
All right, so he was talking about the PBMs. That's the pharmacy benefit managers. Right. I want to point something out in this clip here. And I'm going to put the full screen on and then freeze it. So some of the things he talked about was the pharmaceutical companies have to get on board if they don't agree. So again, he is acknowledging there's a period there where Big Pharma is going to be, it's basically voluntary compliance, ultimately being checked. We know how that goes with big government, but this is what I thought was the most interesting. Now, this interview was yesterday, okay? And this is the Big Pharma stock prices. Now, this was announced that this was going through. Big Pharma, Pfizer, Eli Lilly, Bristol Myers Squibb on your screen, Johnson & Johnson. Except for Johnson & Johnson, everything's up 2%, 3%, 3%, plus 4% for Merck & Company. The stocks were going up here. You would have thought that this would have crushed. Now, I understand the whole stock market was up yesterday. You would have thought this would have crushed the Big Pharma stocks, but it didn't.
They may be banking, Grant, on the idea that if they voluntarily comply, their drug will be the drug of choice on the formulary, for example, for Medicare. And even though you might be able to sell your drug for far less than you could previously, if yours is the drug choice that gets put on the Medicare approved formulary, the sheer numbers of Medicare are so great that they know that they will still make money. So they may be banking on that they're saying, look, we'll comply because we want, pick us. And particularly if they're cutting out the middlemen and they're negotiating directly with the federal government.
The other side to this could be, if you do a mathematical calculation, you bring down the price in the United States, but you're raising the price everywhere else. You may either balance it out. I don't know. Maybe you make more money as you start to raise the prices in other parts of the world. But again, they were arguing this is not America first. If everything, and this is an America first policy, President Trump is literally saying we have to pay the lowest price.
Absolutely. And so perhaps the bean counters at the pharmaceutical companies are saying, okay, we'll precipitously drop drug prices in the United States, but we will at the same time increase the prices across the board to other countries, perhaps more to make up for, maybe make more money, actually increase the prices for everybody else. And it would be such a sleight of hand, the shell game, you'll never actually figure out that we are now making, pick a number, 10% more overall than we'd been making previously, despite the fact that we are now giving Americans a break.
The other side to this executive order, and I've read through it, I've got it on my screen here. It's only 2 pages long. It's not long and drawn out. I think the ambiguity is there to allow for a structure to be worked out as we move forward here. It doesn't say Medicare or Medicaid Part B or just this or private insurers. It doesn't make any mention of any of that stuff. So I'm wondering, are you allowed to set prices for private insurance companies? If you take the middlemen out, I want to buy directly from the pharmacy myself or the pharmaceutical company. Can the government do that? I don't know the answer to that question.
And I don't either. And that's what I was saying. That's why I can imagine how it can be applied very easily to Medicare and potentially to Medicaid, although much of Medicaid is overseen and really functions at the state level. When it comes to the private side, that's a sticky wicket. I'm not exactly sure about the intricacies of that, and I guarantee the pharmaceutical companies will be looking for loopholes there. But I can see how it can work on the federally funded side.
All right, I want to play Caroline Levitt. I've got Democrat reaction. We're going to talk about the pharmacy benefit managers as well. But before I do that, I want to tell folks about this new parasite cleanse that you guys have. And Dr. Victory, it's fabulous. I personally want to get this, and I've got one on the way. I've already ordered it. And let me get the website up of where you can get yours. And do you know, folks, that literally, and I've been doing a lot of research on this, 80% of Americans have parasites in their body. Some of it can be in your brain. It can be in your spine. It can cause fatigue, cause depression. And there's some talk that it's even related to cancer. This is a doctor I saw online, and quite frankly, it's fascinating. I just have to find my video here so I can play it for you. Here we go.
What are the main differences between ivermectin and fenbendazole? These are two anti-pathogens used to treat parasitic infections and other similar types of conditions. They are used quite often in the oncology world to treat cancer. They both have as anti-pathogenic abilities.
All right, so do you believe 60 million Americans could suffer from these things? I saw them in like fish at the grocery store. They were worms. You don't cook that fish through, you're eating that. That's going into your body. Well, the wellness company has a solution for you. Ivermectin and bemendazole. This stuff is great. Everyone I've talked to says it is amazing. All you have to do is fill out a medical intake form for your 3-month supply. Lots of parasite cleanses are all over social media, but the gold standard is this one. It has sold out 3 times. Maha is officially here. The wellness company is making these hard-to-get medications digitally accessible so you can live your best life. Go to twc.health/grant. Use that promo code GRANT for 10% off, and I promise you, you're going to be better for it. I can't wait to start this parasite cleanse because, I've talked to some doctors. I may have some symptoms. I'm getting my body rid of these things. So I'm really happy. The wellness company coming up with some fabulous new products. This methylene blue too. I just started using it. I'll tell you about that. Maybe we'll talk about that in another episode, but really, really quite amazing. All right, Dr. Victory. So I told you I'd play Caroline Levitt. She was on responding to this. The White House is really, really happy about this prescription medication executive order. He says it's one of the most consequential executive orders of all time. I actually think it was overshadowed by the China deal. I think the China deal was really, really big. But let me play Caroline Levitt for you.
The United States of America is less than 5% of the world's population, yet we purchase 75% of Big Pharma's profits. We pay an astronomical amount in comparison to other countries around the world. So the president is signing an executive order today that is going to implement most favored nations drug pricing and is going to reduce the cost of drugs in this country by more than half at least. America is going to pay a better rate and a fairer rate to the rest of the world. That's what the American people deserve. This is huge news. And also, I will add, we know that healthcare costs and drug prices were the #1 driver of Biden inflation. So not only are we bringing those down, but we are ending Biden inflation once and for all.
Well, inflation numbers were down again today, too. And she said it, we only represent a certain amount of the population, and we're paying all the cost.
Right. And this falls strictly in line with the America First agenda. Every single thing the president is trying to do, whether it's the tariffs with China or this executive order with regard to drug pricing, is about saying we want America to be treated fairly. We have been subsidizing the rest of the world for far too long. And it's really gotten to the point where many Americans cannot afford the basic medications that they need to stay healthy, whether it's blood pressure medications, diabetes medications, or whatever. So hopefully this will, as I said, garner bipartisan support. It certainly should. It's been something that the Democrats have been long interested in doing themselves.
Another issue that I would like to see, maybe, I don't know if President Trump could do it through executive order, but you as a doctor maybe could weigh in on this. So I live in Dallas. I go to Baylor Medical Center downtown to the emergency room. I have a C6, C7 herniated disc. I don't know it at the time, but I know I needed an MRI. I'm going to try to make this story short. I know I needed an MRI, not a CT scan, not an X-ray. I knew what the issue basically was. I call them and say, can I get an MRI? I can't get in anywhere else. If I come to the emergency room, can you get me? Yes, they tell me on the phone. I go into the emergency room. They put me on a cot, basically, in the middle of the hallway. I sit there for 2 hours. Try asking for pain medications downtown Dallas. They think I'm a junkie, right? They do give me some kind of a shot that actually did ease the pain. They take me to a CT scan. They tell me I'm clear, no problem, and I leave. I later go back and get an MRI. Another doctor, go see a spine surgeon later, C6, C7 herniated disc. My insurance company pays $4,500 for my visit to the ER. I later get a bill for $200. I get another bill for $400, and I get another bill for $1,200. And I don't understand what any of these bills are. It just is a random organization. I see it's loosely associated with Baylor, and they expect me to pay this.
Correct. This is a real problem. It is so convoluted that the average American can't possibly see their way through it. The issue is that you get a facility fee from the hospital. You get a separate bill from the emergency physician group. You get a bill from the radiologist who actually read the CAT scan. You get a different bill from the radiology department for the scan itself. There are all of these fractionated pieces, and your insurance pays a portion of each depending on what they've negotiated for percentages with the hospital and each of these individual groups. Interestingly, what I encourage people to do if they can, if it's truly not an absolute emergency, is to go to a freestanding radiology or diagnostic center. You can go and ask them for the cash price even. I can pretty much guarantee you that if you went and purchased an MRI of your cervical spine with cash at a freestanding facility, it probably would have cost you in the range of $400 total, including the reading. Yep. So you would have gotten your answer and paid far less than you did by going to the hospital.
I can confirm you're absolutely right, because what I did was exactly that. The problem was I had to make an appointment and I had to go in. And the other issue was I literally felt like my arm was going to fall off. I don't normally go to an emergency room. I didn't just go for the MRI. I went because I was in so much pain. I didn't know what to do. And I thought the emergency room over one of the urgent care centers would have the MRI because they told me they would, and then refused to give me an MRI and then hit me with a bill. Long story short, I'm in touch with the vice president of patient relations at Baylor Hospital. But the only reason I get to talk to the vice president at Baylor Hospital is because I threatened them with a national news story and telling my story about how ridiculous this pricing is. And I said, the average everyday person can't get to you. You know what he told me? You know what he told me? Yes, he can. You just call the number that you called. Well, little did he know that I had called back the number he called for on my phone, and I didn't look at his personal line in my phone. And the voicemail that I got to that number was, "We are overwhelmed with phone calls. Please send us an email and we'll get back to you." And I told him I said, "You think people are going to be happy about that? Send me an email?"
No, it's ridiculous, and most people will give up, and most people, frankly, end up giving up trying to understand the bills, and they simply pay them. And the insurers and the facilities know that. This has really been a problem. We need such huge reform in the way that our billing is done in the United States for healthcare. I'm sorry you had to go through that. It is absolutely horrific, and I hear these stories, unfortunately, on a daily basis.
They should make the emergency room, especially if you're going to an emergency room, give you one bill and let the emergency room, like a general contractor, pay everybody out of that. You shouldn't get 18 bills from 18 different people. I think I'm going to Baylor. Let Baylor give me a bill. So anyway, long story short of it, I let it go to collections. You know why I let it go to collections? Because I know there's a law that they can't send my medical debt to a credit bureau. Now, I don't think everybody else out there knows that. So I let it fester over there until they start calling me, and that's when I got upset. Well, they took it out of collections. I'm waiting to hear. They were very nice, Baylor. He was very understanding. He says, we hear this all the time. So we'll see what they come back with.
You can also, I will tell you, you can also negotiate with them. You can call Baylor and say, this is what I will pay.
Yeah.
People don't know that. You can actually call and negotiate with them and say, here's what I think is fair, and this is what I'm willing to pay. You've already received X amount from my insurance company, and I am willing to pay X amount additional. But patients have more power than they might believe once it goes to collections and you say that you're willing to negotiate.
Yeah, for sure. All right, before I let you go, I do want to ask you about pharmacy benefit managers. This gets back to the prescription drug pricing. In America, these middlemen, these PBMs, basically set the prices, and they set outrageous prices, and they're taking commissions off of this. Is that right?
Yes, fundamentally, a PBM, what we call a middleman, was somebody or an entity that is engaged to negotiate prices with a pharmaceutical company on behalf of another entity. So say I have run an office, or I'm a hospital. Say I'm a hospital. I don't have time to go to all of the different drug companies and figure out what to put on my formulary at the hospital, what antibiotics I want to have in the hospital pharmacy, what other blood pressure medications, all that. So I hire a PBM and I say, you go out and negotiate for me and get the best prices that you can. Well, and by law, the PBMs were allowed to be paid by me, the hospital, a certain amount. They were allowed to mark up the drug prices by 2.3% by law. Over the years, it has been totally ignored. And what's happened is the PBMs have gone to the pharmaceutical companies and said, if you want to be on the formulary, Mr. Pharmacy, and be on the formulary at Dr. Victory's hospital, you're going to give us a kickback. You're going to pay us, and we will put you on the formulary at Dr. Victory's hospital. This is essentially government-sanctioned racketeering. The PBMs are back alley thugs. They go and tell the pharmaceutical companies, if you don't give me X price or give me this kind of a rebate, people think the rebates are going back to patients. They're not. They're taken by the PBMs. Wow. So they go and they tell the pharmaceutical companies, if you don't give me the price I want or pay me off, I will not put you on Dr. Victory's formulary. So it is responsible for driving up drug prices exponentially, Grant.
How do we get rid of them? President Trump said he's working on this. I don't know if this executive order does anything to do that, but how do we get rid of them?
Well, it's something that either needs to be addressed by Congress. They're the ones who put into place this loophole, this safe harbor loophole that allows the PBMs to make some amount of money. And if they are in fact negotiating, it's sort of like a realtor. If the realtor is a transactionalist between the person who actually owns the home and the person who wants to buy the home, and they take a standard fee, generally depending on what state you're in, of 4 or 5 or 6%, whatever it is. They aren't able. Can you imagine what homes would cost if the realtor said, look, if you want me to sell your home, I'll do it, but you're captured. You can't do it on your own, and I'm going to charge 100%.
Yeah.
That would double the price of the home. I mean, you couldn't do that. So we've got to either enforce the law as it's written, which means that they can charge only a very de minimis amount of money, a number of percentage points, or eliminate them entirely and have the hospitals and doctors' offices and other entities hire somebody on their own staff to be a negotiator.
If I remember correctly, Congress had a chance to do this just very recently and punted on this.
Correct. They put, and the reason why, because there isn't anybody in Congress, from what I can tell, with rare exception perhaps, on either side of the aisle who is not taking money currently or taking money historically from the pharmaceutical lobby. This is a big, big problem. We have got to stop people in Congress, senators and representatives, from accepting monies to their campaigns from the pharmaceutical lobby.
So it's interesting you say that. I would disagree with you on that. I think it's up to the American public to figure out who's taking money from who and make a decision whether it's affecting their decisions or not. But money is speech in America. And just because I may not like your industry doesn't mean that I can take away your speech. And so I would disagree on stopping any, because now what happens is somebody says, well, I don't want the construction industry to give money. I don't want the media industry to give money. I don't want this. I don't want that. I want to be able to make a choice, and I want the money, how it comes in, transparent. We may have a bigger problem with money going to PACs that's not transparent, and we don't know who's actually receiving the money, but I'll give you the last word on it.
Well, while I agree sort of with the sentiment of what you're saying, the reality is that Americans are over a barrel right now. We are being raped, as I said, on the cost of all sorts of things, while politicians get their coffers filled and live the high life. The rest of us are suffering, while the people in Washington, really, are living large, and that just doesn't work.
Unfortunately, it is very true, and much of that money comes from lobbyist money as well. So, the lobbyists that represent Big Pharma give money, right? So you don't
100%.
know that it's Big Pharma that's giving the money.
100%.
It's the lobbyists that represent Big Pharma that are giving the money, and so people need to wake up, and they need to get smart. You need to start electing really principled people into office. Make America great again, politicians. There are some out there. There's not a lot of them, but there are some. Andy Biggs, Marjorie Taylor Greene, Lauren Boebert, Matt Gaetz when he was in office, Eli Crane. I could go through a whole slew of them that come. And it's no coincidence, Dr. Victory. They all come on my program, which is interesting. And the rest of them that I'm not naming don't come on my program. So that should tell you something. But, hey, I always appreciate talking to you. It's fascinating stuff. I love the organization you're with, the Wellness Company. So a big thank you to laying it all out for me.
Thanks so much for having me and for your support.
Absolutely. And, folks, before I let you go, let me again tell you, first off, the Wellness Company is great, folks. They are such proponents of free speech and making sure that you get to hear the voices that you need to hear. The Wellness Company, twc.health/grant. Use the promo code GRANT. This is the kit that I showed you before. It's got many of those prescription medications you need. There's another kit. This is the field kit. It's even bigger. There's an EpiPen in here. Here, I'll open it up real quick so you can see inside it. There's an EpiPen in here, even more medications, ivermectin in here. There are steroids in here. Man, if you're a prepper or you want to really be prepared, this is the kit you need. Or you do like me and you get both of them. Anyway, twc.health/grant. Use the promo code GRANT for 10% off. And listen to me very carefully. On this parasite cleanse, this is the bomb, man. How many of you are walking around with parasites in your body? Get it cleaned out. The 3-month cleanse is fabulous, okay? I'm getting it. I'm going to give you a firsthand report of my 3-month process through it. But once I saw those worms crawling around and fish in a grocery store, I said, you know what? I'm sure I got parasites. I want them out of my body. twc.health/grant. Use that promo code GRANT. All right. Real America's Voice show tonight, 7 p.m. Eastern time. President Trump taking a lot of heat on this airplane from Qatar. That's going to be the next Air Force One. I'm going to tell you why you shouldn't be worried about it. That on the show tonight and so much more. Stinchfield's Army rolls. Thanks to all of you. We'll see you tomorrow.